The resurrection of bone broth from grandmother's kitchen to $28 per quart commodity, with market projections reaching $2.8 billion by 2027, represents either nutritional wisdom rediscovered or brilliant repackaging of stock as wellness product. The collagen claims driving this trend deserve serious scrutiny because they're misleading consumers about basic digestive biology. Here's what nobody wants to hear at bone broth cafes. When you consume collagen from bone broth, your digestive system breaks it down into amino acids. It doesn't arrive at your joints or skin as intact collagen molecules ready to plug into cartilage or dermis. You're consuming amino acids, primarily glycine, proline, and glutamine. These amino acids support collagen synthesis if your body needs them, but the direct joint support claims are biologically nonsensical. Gastroenterologists explain this patiently, but marketing ignores digestion in favor of appealing narratives. The amino acid profile of bone broth does provide glycine in higher amounts than muscle meat, potentially supporting endogenous collagen production. But you could achieve similar effects with gelatin powder for pennies per serving rather than dollars per quart. The mineral content depends entirely on preparation method, cooking time, acid addition, and bone type. Some preparations extract meaningful calcium and magnesium, others don't. Commercial products vary wildly without nutritional transparency. The gut healing claims promoted in wellness circles lack rigorous clinical evidence. Glutamine in bone broth might support intestinal cell health theoretically, but controlled trials demonstrating healing of leaky gut syndrome or inflammatory bowel disease are absent. Anecdotal improvements are real and meaningful to those experiencing them, but they don't constitute scientific evidence requiring pharmaceutical-level scrutiny. The nose-to-tail sustainability angle is the strongest argument for bone broth. Using animal bones that would otherwise become waste utilizes the entire animal, aligning with ethical meat consumption. However, this benefit applies regardless of whether you make bone broth at home or buy grass-fed organic bone broth at $8 per cup. The environmental impact of industrial animal agriculture remains concerning even when using bones. Commercial bone broth often contains alarming sodium levels, sometimes 800 to 1,000 milligrams per cup, problematic for people managing blood pressure. The grass-fed and organic claims increase cost, but questionable whether they meaningfully change the amino acid profile compared to conventional bone broth. Rheumatologists dealing with arthritis patients report frustration with bone broth marketed as joint medicine. Some patients discontinue effective treatments believing bone broth is sufficient. This isn't harmless marketing, it's medical advice disguised as food. Meanwhile, the actual protein quality of bone broth is inferior to muscle meat because it's dominated by non-essential amino acids rather than balanced essential amino acids. The bioavailability question remains unanswered. Even if consuming collagen-derived amino acids helps synthesis, how much you need, how often, and whether bone broth is the optimal delivery method are all unclear. Research on supplemental collagen peptides shows some joint and skin benefits, but these studies use concentrated supplements, not cups of broth. My assessment is bone broth provides modest nutritional value as an amino acid source, but doesn't justify medical claims or premium pricing. Making bone broth at home from leftover bones is sensible waste reduction. Paying $30 for artisanal bone broth as medicine represents expensive placebo. The cultural revival of traditional food preparation is valuable, but wellness industry exploitation of this revival through pseudoscience and premium pricing deserves skepticism.